Good morning, America, and welcome to this morning's huddle brought to you by Going on Offense. My name is Darrell Moon, and I'll be your host today, and thank you for being with us. We hope you'll join the conversation. We have a wonderful guest panelist with us today to talk about partnering with your physician to stay healthy. We're holding these huddles every Monday, Wednesday, and Friday in an effort to support those struggling, to brainstorm strategies to help, to promote resources, and to engage collaboration. Now to introduce today's guest. It's my pleasure to introduce to you my friend, Dr. Donna Milavetz, Senior Vice President of Steward Medical Group, Utah and Arizona. I'm going to invite Dr. Milavetz to take 4 or 5 minutes to introduce herself and share a comment or two about today's topic. But before I do, I want to invite all of you to participate in today's conversation. We would love to include you in the conversation. Please raise your hand on the control box at any time during the huddle, and I'll turn on your microphone and we can have you join us by audio, or if you'd just like to send in a comment or a question, use the question box on the control box or control panel to do that. Dr. Milavetz, would you like to introduce yourself?
Sure, absolutely. First of all, Darrell, thank you so much for the opportunity today, and to all of you out there in Cyberland. It's a pleasure to meet you virtually, and I look forward to a really engaged conversation today because I think this is a really important topic. I am an internal medicine physician by training and profession. Did my undergraduate medical school at University of Arizona, trained at one of the Harvard teaching hospitals in Boston, and then proceeded to get my master's in public health administration with a minor in epidemiology at the University of Minnesota School of Public Health. I spent a fair amount of my career doing women's health, running both a women's heart clinic for the Mayo Clinic Rochester before moving to Utah, where I consider home now, and worked for Intermountain Healthcare and ran their Women's Health Center comprehensive program up in Ogden, Utah for a while. I then became an entrepreneur and started a healthcare company called On-Site Care, where we put primary care clinics on the campuses of large employer group. Had a successful exit of that company in January of 2019, and then was asked to join Steward Healthcare to run the medical group for Utah, and then to be their physician liaison in Utah and Arizona for their affiliate network. So I've had a varied background of different hats throughout my medical career, including just regular clinical care. And now running the medical group during this pandemic has been a very interesting and challenging, although very rewarding time for me, both professionally and personally, to work with such talented colleagues and during this really difficult time in our nation and for our patients that we serve. Just a minute about Steward Healthcare. We are a fully integrated healthcare system. We have the medical group, a fully employed medical group, a hospital system, and then an affiliate physician network. We are the largest privately held health system in America with global enterprises, 10 states, and about 41,000 employees. So I'm proud to be a part of that organization, and I'm super pleased to be part of this conversation today because I think there's a lot of fear that's out there right now. Some of it is absolutely appropriate, and some of it is keeps people held in place that they shouldn't be held in place from their healthcare perspective. And I hope by the end of our conversation today that you feel better about how to engage with us, your physician partners, resources to reach out to. Maybe we'll touch on some questions about serology testing and PCR testing and other measures for you to continue to keep safe. But throughout all of this, I want to continue to give a message of hope that we will persevere through this. And there are challenging times, absolutely, not only now, some that we've lived through and some that are unanticipated in the future, but we are a resilient country, and we are resilient people, and I think together we can do anything. So with that, I'll turn it back to you, Darrell.
Well, I would love to just hear from your perspective, because you're working with a lot of physicians in a very unprecedented time. How are physicians coping with this? How, tell us a little bit about how crazy it is or what it's like to be a doctor in the
Yeah.
middle of all this.
Yeah, so it's fascinating. So we have both inpatient physicians that are hospital based, so our pulmonary critical care doctors, as well as our surgical teams that continue to do surgeries. People still are having heart attacks and need open heart surgery, and people still break bones and need their gallbladders taken out, as well as outpatient doctors that continue to provide clinical care both in person as well as virtually now, which is a really big component of the outpatient environment. And I think every day, every physician is nervous going to work, that we're doing everything that we can to keep our healthcare workers as well as our support teams, right? People who are at the front desk checking patients in, and scrub techs that are working alongside with our surgical teams, that we're doing everything that we can to keep everyone safe. We talk a lot about safety and about PPE and how to use it effectively, how to keep them safe at work, but also safe when they go home to their families, because everyone's super nervous right now. And I think there's a fair amount of anxiety that's out there, but I think we all recognize that we signed up for this. We took an oath to help people and to power through that fear, to recognize it, that's our sort of psyche telling us to be careful. And I think that that's important to listen to, but also to recognize that we have an obligation to care for our patients. And so we continue to do that. We have lots of resources for our team members through EAP programs, and then just talking among our peers and what that feels like, and what's it like to wear a N95 all day long, and how to do that in the OR. And it's challenging. All of our hands are super chapped from all of the hand washing that we're doing, but I think overall we have a sense of pride and a sense of great sense of privilege in being able to care for people. And I don't. We have not been hit nearly as hard as our colleagues back in the East. We have several hospitals in the greater Boston area, and in talking to them, their stress level is very different than ours here in the Utah market. But patients are alone in the hospitals because we need to keep the rest of their family members safe, and the rest of the workforce in the hospital safe. And so having the privilege of being that person to hold somebody's hand is an honor, and we take that very seriously. So it's complicated, and it's a good bad, not a bad bad, as I like to say. It's what we do and what we train for, and every one of us has stepped up to the plate to help out, and I'm pretty positive that when we get to a different place in time, that there'll be a lot of debriefing about this, and maybe picking up some pieces at that point. But right now, we're just powering through.
Yeah. So you talked about the anxiety it must be for a physician or his team or her team to go to work and just deal with the challenges. Talk a little bit about individuals who may come up, may come down with something. And I've heard that a lot of clinics are slow right now because of the fear of going into a doctor's office, for fear you might catch the virus, from another patient. But talk a little bit about what's an appropriate utilization, and should we be afraid, and what level of fear should we have about going to our doctor, and should we use telemedicine, and when should we maybe go in versus use telemedicine? Talk a little bit about, as a person, how do I access my doctor?
Right. Yeah. No, it's a great question. So I'm going to talk from the infection control standpoint first, and then we'll talk a little bit more about how to access care and when to access care and why to access care. So on the clinical side of medicine, I'm going to talk specifically in the outpatient arena for right now, so going to see your doctor. We have taken extraordinary measures in keeping our patients safe, as well as keeping our workforce safe. So you will see in every office, no matter whether it's a Steward healthcare facility or any other medical group, that you will have every one of our care team providers be masked and gloved. There will be plexiglass in the reception area when you walk in. As a physical barrier, and you will see the waiting room be very differently situated, right? 6 feet apart. Many clinics are doing well visits in the morning and sick visits in the afternoon so that we can do some deep cleaning. We're doing car check-ins for patients so that they actually are not in our waiting rooms, so that they come in and then are immediately roomed in an exam room. And we have very specific and detailed cleaning protocols in between patients and just sort of overall. We do pre-visit screenings that I think most institutions are doing now, which is you'll get a phone call the day before your appointment saying, do you have a fever? Do you have any respiratory symptoms? A list of questions developed by the CDC that we screen patients ahead of time to make sure that they're safe coming in. And then if they are feeling ill, that they are appropriately masked to come in. Additionally, we are mandating for every single patient that comes into a practice that a community facial covering is used, whether or not that's a homemade mask or a scarf or a bandana, but some sort of facial covering, because that's important. And then you'll see more social distancing with us. Is anything that we can do contactless, we will be doing. So I think I feel really confident in saying that from us infecting you standpoint, meaning the medical community affecting you, I think the probability of that is very low in the outpatient arena. Now, depending on the hospital that you go to, if it's a very high COVID positive hospital, I would say that we are absolutely looking at cohorting, which means that there are certain hospitals that we only do surgical procedures that on COVID positive patients, and that COVID negative patients go to a different facility. So if you have, God forbid, a burst appendix and you're COVID negative, you're going to hospital A as opposed to hospital B. So we're very intentional about that on the inpatient side as well, along with, great intentionality on the infection control on the hospital side. So let's talk a little bit about patients now. So I, as an internist, I go in algorithms in my head. That's sort of how my brain works. So I tend to think of life in two buckets: healthy versus sick. And so let's talk sick or chronic disease first. So this is for ongoing care management, or I'm feeling ill. Some of those symptoms can be managed in a telephone visit, which we are absolutely advocating as a medical community at this point. We're still in that, cautious expansion of loosening of services specific to the Utah market now. We've gone from red to orange in terms of that restriction lifting. But I still think that the most prudent thing is if you can do your visit telephonically or in a virtual platform, and you can do that, that is probably the preferred method at this point. That will change over time, I'm sure. So chronic disease management, diabetes, hypercholesterolemia. We're doing a fair amount of mental health management now telephonically, which is great. And to be fair, I think a lot of patients like it, right? They don't have to leave their home to get the health care that they need. There are certain things that you just have to come in for. If you're having respiratory symptoms, as an example, I can't listen to you through the screen. I need to listen to your lungs. And there's great value in that, that nonverbal communication, as well as what I like to say, passing the eyeball test, which is, do you look sick? Because a lot can be ascertained from just physically and visually assessing a patient. So from a pecking order in terms of value that we have as a practitioner to you, a visual contact is always better than a telephone one for us, because you can see the patient and see how they're doing. So again, on the sick side, there are certain symptoms that you have to come in for, and certain chronic disease care that you don't need to come in for. And when that happens during that pre-screening visit, teams will ask you those questions. Is this something that we can convert to a telephone visit or a telehealth visit? Additionally, our physicians are also engaged with those assessments to say, oh yeah, Mrs. Jones, we're just doing a 3-month, blood pressure check. So yeah, we can do that over the phone and use home blood pressure monitoring kits to help assess the patient. Or no, like I really need to see that patient. So that's important in this. And then let's talk a little bit about wellness visits, right? As someone who advocates for preventive care every day of the week, that I think that there are several different categories of that. So one is on the adult side, your 30,000-mile check that you have to do, like every year you should. So coming in and making sure that that the hardware's working okay. It's getting your blood pressure checked, getting annual screening exams from a age appropriate and gender specific. So breast cancer screening, cervical cancer screening, colonoscopies, all of those right now, we're saying schedule them, but schedule them for August or September. Let's just wait for a minute on those. On the adult side of things, and I'm using that word intentionally because we're going to come to kids in about a minute. Okay. So schedule those, get them on the books, put them on your calendars, but let's delay that a little bit, unless you have, God forbid, a breast lump, and that's something that you need to come in for today, and we'll just take care of you. So those age-appropriate screening and annual exams can be done, but should be done later in the year. The next piece is for our Medicare population. Oftentimes, we can do an annual wellness visit, and we can do those telephonically. Their check-ins, their safety checks, fall prevention, mental health checks, all of those things should be done, and those can be done virtually right now. So that's the adult world. And the kid world, it's a fascinating time because it's becoming a little bit more tenuous. So we've asked everyone for their well-child checks, stay home for a little while, let's see what's going on, right? As a parent, we wouldn't want to bring in our healthy kid to potentially get exposed to a sick kid, right? Or a sick kid, God forbid, with COVID or COVID symptoms. But what we're seeing now is those, depending on the age group, childhood vaccinations are really important, right? It's an important public health measure. And if you are getting behind as a kid on your vaccination schedule, that's going to become a problem for society, right? We're having measles outbreaks because parents are not immunizing their kids. And now we're saying, just don't come in, and you can't give a vaccination virtually. And if we can, I want to be on that bus, right? So that's one of those things that you have to come in for us to give you. And kids should not be getting behind. And it's becoming a real issue in the pediatric population. So again, I think it warrants a phone call. You can delay some vaccinations for a certain period of time, but some of them we would want to have that conversation. So I would say to parents on this call today that's a really good reason for you to reach out to your pediatrician or your family medicine doctor and say, hey, where are we with my kids' vaccinations, and should I be coming in for that? Yeah. So that's kind of the kids side of things. So bottom line is we're still here, and you should pick up the phone and call us. And we're proactively reaching out to many, if not all, of our patients to say, how are you doing? What's going on? I also think that if you're on a 30-day medication supply, now is a really good time to bite the bullet and get on that 90-day supply, right? So It's less expensive, and it's also it's a good time to not have to go out and go to the pharmacy or sign up for the mail order thing. But those little things, I think, make a big difference. So I'm going to pause and see if
Yeah,
you
that's
have
good.
other questions or comments or thoughts about that.
I'd like to go into a conversation about partnering, like the topic today, partnering with your physician to stay healthy. Talk a little bit about the role that a physician plays in lifestyle medicine and in helping people. Right now, people are worried about catching the virus, and clearly the better the immune system, the better chance you'll have of surviving it. So talk a little bit about, from a physician's perspective, how do we partner with our physician to stay as healthy as we can?
So great question. And I know, Darrell, this is near and dear to both of our hearts in terms of partnering to stay healthy. But what we're seeing from a COVID standpoint is that people with weakened immune system or decreased lung function have a higher risk, are sicker, and have a higher chance of death than their healthier counterparts. So things like smoking is a really big deal now. We can see that the stats that came out of Italy. And interestingly, in China, I'm not sure if this is necessarily common knowledge, but when you look at over the age of 65, the population that are dying are men in China, and that's because like 100% of them smoke, or like
Really?
a lot of them, most of them smoke,
Really?
and a lot of Asian women don't.
Interesting.
So smoking is a really important risk factor for COVID. And I would say it's a really important risk factor for just badness in general, right? So
if you wanted to stop smoking, now's the time. You got to really
do it now. Now is the time. So it's a hard thing to do. I know every smoker wants to quit, but now is a really important time to do that, and because it has really important health implications specific to COVID, and maybe sort of that little push that you need to get you over the finish line. So, so that's important. Obesity in the United States is rampant, and that is an independent risk factor for COVID. And you know, there are a lot of memes that are out there, and I don't know how many of you have kids at home, but I've got 3 kids at home now, and so they're constantly showing me stuff on social media, which is for the most part hysterical. But
Yes.
you know, gaining sort of your pre-COVID lockdown weight and your post-COVID lockdown weight, and everyone's at home and it's like stress eating. So obesity is a really important risk factor, not only for chronic disease, but also for COVID, we're finding. And so, although it is challenging, I think that now is a really good time to start looking at nutrition. We have some more time, we're home, like restaurants are just starting to reopen now, and yes, you can do some takeout with it, but now is a really good time to be thinking much more intentionally about the fuel we put in our bodies and what that fuel looks like, making sure that we are exercising every day in whatever capacity that needs for you, whether or not that's walking or you know, bike riding or running or using exercise equipment in your house. There is a ton that's out there on social media talking about virtual classes that you can do, downloading videos to do in your home. And I think it's important for us to make sure that we are very intentional about doing daily exercise. It's also really good for our head, right? For our mental health as well as our physical health. It's an incredible stress reducer. I tell you, it is my drug of choice for myself from an anxiety standpoint to exercise. And I think that it now more than any time, it is important to get more physically fit. And it is a risk factor for COVID. So it's another little push. I think sleep is really important and very underrated in terms of what we talk about getting appropriate rest and really good sleep hygiene. So I think that fits and factors into this mix as well. And then, you know, other unhealthy lifestyles in terms of, you know, moderating your alcohol intake, and then, not ingesting other illegal substances that are potentially out there that we can use. So I think from a holistic standpoint, it is important from a clinical standpoint that we take care of our bodies and our minds and our spirit, but it's also from a infection control standpoint, I think it is really critical. I can talk all day long about healthy lifestyles and about fitness and about good nutrition and about good sleep hygiene, but I'm not the one in your body, you are. And that partnership is really, you get to do the hard work, sorry. I can talk to you about it. I'm happy to be your partner in it, but you got to do the hard work in all of this.
That brings up a thought. On Monday, we had a Dr. Paul Larson. He's the Global Education Director for UPMC. And we talked a little bit about the influence that a doctor has in kind of engaging people and taking, look at that kind of stuff. And clearly, you have to find what the person wants to change. You can't say, here's your prescription. However, I think a doctor does have some influence, and that white coat syndrome to say, look, you really need to exercise, and let's work together. What kind of exercise would work for you, and trying to get the person to come up with a plan, but then supporting that. Talk a little bit about how primary care practices are expanding to be more multifaceted with different disciplines in an effort to not just take care of the sick, but support individuals in engaging in healthier lifestyles. Talk a little bit about, I know your clinics have done some fun things, but talk a little bit about that role and the influence that a primary care practice and that multidisciplinary team can have on helping people stay healthy.
Yeah. So traditionally, healthcare has been a disease-focused model that you interface with the healthcare system when you're sick, as opposed to when you're healthy. And we do problem-focused care when you come in, and then we don't necessarily think about the whole body in a more holistic approach. And that shift really changed. The ACA, in all candor, really helped that, because prior to the ACA back in 2008, it seems like forever ago now, right? That preventive health services weren't very highly reimbursed. And yes, sometimes it is about money. But with that shift, primary care specifically became much more engaged at looking at the sort of the holistic approach to our patients. And I agree with you, Daryl, that there is influence that a physician can have in that informed decision-making and that partnership, because we can bring to the table the clinical side, and I can see those 7 steps ahead as to what's going to happen if you don't, control your blood sugars and watch what you eat, that what's going to happen. And it's that partnership together to say, how do we get you from point A to point B together? And what does that look like? And what's realistic for you to do? So I do think that there is that partnership to do that. And I do think that now more than ever, primary care has really embraced the whole person in that relationship. And finding what those triggers are, right? Like, what are people's relationship with food? And why do we use food for a stress reducer? And are there other substitutions that we could use instead of food or sugar specifically to help understand and manage that stress, if you will? I think that we are partnering with complementary healthcare. Some people would call that Eastern medicine, whether or not that's acupuncture or chiropractic care. I've seen red light therapy in terms of UV therapy that's out there, having a nutritionist in the practice, having mental health counselors, behavioral health, because there is absolutely a connection between stress and anxiety and eating. And all of those things are very interwoven. And if we don't address the holistic problem and issues, then we are really missing an opportunity to really help engage our patients in a more meaningful way. So I think those strategies are really critical. I think, I come from the employer space, so clinics that we've done in the past look at fitness challenges and healthy eating challenges that I think a team approach or a socialization of that, I think is really important. Getting out and running with your doctor is a cool thing. Plus, you get to chat and talk at the same time about different healthcare stuff. I was out on a roll, social distancing, on a run this past weekend, and we were talking about women's health stuff with the sort of women's group that I was running with. So it's an opportunity to do those things in a different setting that may feel a little less intimidating. Like, to be fair, some people really hate going into a doctor's office, right? It triggers them in different ways. And so if there's different opportunities for us to engage with you, I think that's fantastic. And I think that we have the ability now to engage better. I think there are fantastic apps that are out there now that we as a medical community embrace and help with you. There's wearable technology, and I'm wearing my Garmin now in terms of counting my steps and talking about my fitness level. So I think now more than ever, the medical community can and should and does embrace sort of the more sort of holistic, technology based and socialization aspect of mind, body, spirit care.
Wonderful. I'm going to remind everyone that they're welcome to share their questions. I could keep asking Dr. Milavetz questions all day because this is fun for me, but if you've got a question you'd like to ask her, please send that through with a question. But let's talk a little bit about this whole idea of now's the time. We've got the pandemic. We've struggled in the past to get people to do that annual wellness visit. And I think we almost need to give everybody permission that it's a good thing and it's something you should do. And even if it's over the phone, call your doctor and have that annual wellness visit and talk about staying healthy. Talk a little bit about how do we go from 10% of the population doing their annual wellness visit to maybe through this pandemic, we can move that up to 80%. Call your doctor, work with the team.
Yeah, I would say yes. Yes, do that. I would challenge everyone on this phone call and to tell their 10 friends that that now is the time to schedule your age-appropriate screening tests. That carpe diem, right? Now is the day to do this. That get that screening mammogram on the books. Schedule the appointment. Just do it, right? You have the time. You can't use the excuse if I don't have a little extra time. So schedule that appointment now. Sign up for your patient portal. Figure out how to use that patient portal because every single physician's office has one now. To be able to start asking questions and to request an appointment, if you will. I would say, if you're over 50 or have the appropriate risk factors, that screening colonoscopy, super important. Yeah, it's the prep stinks, but the drugs for the test are really good. So now is the time to get that scheduled. And yeah, I think it's okay to invest in oneself. I think now is a really good time to do that. We're so focused on this pandemic and feeling this sense of hopelessness and helplessness, right? Like, how do I even manage this? It's too big for me. This is a tangible thing that each and every one of us can do, right? This is an action item that we can do. We can call in and make an appointment. We can have a virtual visit. We can get our age-appropriate screening on the books, and that's us empowering ourselves. That's us taking control and moving the dial forward with our own healthcare. Same thing with the fitness and exercise and nutrition. All of those things are very self-directed, which you have absolute control over, like 100% control over.
Right.
So it is really critical that people do feel empowered to do that, and absolutely that we should have and need to have higher levels of compliance when it comes to for screening tests as well as exams.
And is it okay to use the telephone or schedule a telephone wellness visit with my doctor? In other words, maybe I don't want to come in, maybe it's not okay to come in, but maybe is it okay to schedule to say, I would like a phone consultation with my doctor to talk about how do I stay healthy, build my immune system. Is it okay to do that?
Absolutely.
Okay.
And I think that it's therapeutic on a couple of different levels, right? Number one, there is something very unique about being human, that we are social creatures, which is why this social distancing and quarantining and shelter in place are uniquely hard for us, because we are social creatures by nature. And that has nothing to do with whether you're an introvert or an extrovert. We are just social creatures. And so having even just that FaceTime interaction, I think is therapeutic, right? It adds to that enhancement of health. So yes, so that's the first, that on that level, absolutely. Number two is it's a really good time to do a medication review, right? Like you're literally in your house, you can hold up to the screen what that bottle looked like, that little pink pill that I still don't know what it is that you're taking. Like, let's do a medicine cabinet review. Those visits are really important, and they frequently get waylaid by just our busy lives. So I think it's important to do those, and I think it adds to your overall health, and I think it also adds to that relationship building, because then I get to know things about you that I necessarily wouldn't have known. The other really interesting thing is that because most people are at home when they're doing their telephone or virtual visits, is it gives me as your physician a window into your life, right?
Yeah.
And that social aspect, especially for our older patients, like I can do like a home assessment. I'm like, okay, put the screen down. Let me see what those rugs are. Let's go into the bathroom. Do you have grab bars? Those things we never talk about or infrequently talk about. And I think it's really important. So that this time is really critical to do that. And trust me, our doctors, like, we have time. We're not like, oh, we'll see you in 4 months. It's let's do it now, kind of thing. So I think that now is the time to capitalize on that, because we are a captive audience, because we still have to come to work, and we're here for you, and this is a really great time for us to engage with you.
Nice. You brought up something I think that's very important a few minutes ago, which was the mental health aspect. This whole going on offense movement is really to try to not just sit back and hope everybody's going to be okay, but to proactively address the emotional well-being. It's something that there's fear associated. I mean, there's the fear of the virus, there's the economic demise and all the challenges that come along with, lower income and I think a physician plays an incredibly important role at helping people get over the hurdle. I mean, some statistics say that people wait 10 years after mental health symptoms begin before they'll seek help, and 57% of people never seek help. And I think the physician can play, if we partner with our physicians and we get to know our physicians, and they can play an incredibly important role at helping us get over the stigma of going and seeing a mental health professional.
Absolutely. Listen, I am the biggest proponent of a holistic care strategy for patients. And I think most, if not all, physicians subscribe to that now. And mental health, behavioral health, life skills management, however you want to define it, I think is really critical. And I think in the past, we have minimized as a medical community this, and to be fair, I think may have contributed to the stigma of it, but not in 2020. I think 2020, having stress, anxiety, generalized anxiety, PTSD, more of the harder core diagnosis of major depression, bipolar disorder, schizophrenia, it's just like having high blood pressure, right? Like we don't blink an eye when somebody says they have high blood pressure. And so I think we as a society need to normalize that, even now. And I think with the whole awareness movement from suicide prevention and risk mitigation, I think talking about it, sharing stories. My child suffers from serious depression, and she's medicated, and thank goodness she's safe. But you know, that's me. It's real. It happens to everyone, right? It bridges every socioeconomic class, and I think that it's important for us to manage that. I get super stressed out too. This is probably perhaps the most stressful time in my professional career ever. And it's hard. So I think talking through it with each other, I think is important. I think from a medical community, if your doctor isn't asking you basic depression questions when they see you, I think you should call them out on it, because it's part of, it's like a vital sign now in primary care, because it is that important to ask, and it is that important to treat. No one's gonna really volunteer that they're suicidal, right? They may give you subtle signs saying that I'm not eating, I'm losing weight, I'm not sleeping well, or I'm eating too much, or, you know, I lost my job. But to come right out and say, listen, I'm thinking about harming myself, I don't, it takes a very important and intimate relationship with your doc to get to that level of comfort to do that. So I think it's on us to make sure that we're asking those questions. But it is a partnership, and I would say that if you are struggling, that yes, absolutely reach out. And I think now more than ever, we are reaching out because we're worried. Especially with our older population that is much more socially isolated than people are. Even like going to the grocery store is kind of a big deal now, right? Like, woo, I get to go to the grocery store. But our older patients aren't, right? They're having their groceries delivered, and they're just really sheltering in place. And so it's important to reach out. I would say to each and every one of us, it's important to reach out to your extended family and your extended communities. I spend, you know, a half hour every day reaching out to people just on simple texts saying, how are you doing? And I have on a rotation so that I'm hitting my network to say, are you doing okay? Do you need anything? Just checking in. And I think those check-ins, I think, are important, not only with your doctor, but also with your support team, and then your expanded circle, that acquaintance that, you know, you haven't done in a while. I think there's also other aspects that we can engage in to help us from a mental health, and I use the word health standpoint. You know, there are memory games out there that people use to sort of help with our sort of cognition. And I think from a behavioral or life skills management or mental standpoint, that health is important, right? We exercise and we run, but what are we doing to help our spirit and our brain in terms of that mental health? So again, the Zoom meetings, having a happy hour, or having a cooking class together, doing virtual book club, or just chatting with your you know, friends, I think is really important. And as time goes on, it takes effort to do that, right? We tend to regress to the least common denominator, and I think we have to be intentional about that. Just like intentional about reaching out to your physician, intentional about making a game plan every day to what am I doing for self-care, right? Because that's what it comes down to. It's a self-care strategy, because I think that helps from a mental health standpoint.
You said something that I want to underline. You know, studies before the pandemic say that 60% of workforce experience mental health symptoms that affect their job. This was prior to the pandemic. Now that's probably even greater. And it's not okay to just give people phone numbers in case they need to reach out. It's the proactive. It's how do we reach out to people? I loved what you said. I want to underline. You spend a half an hour every day to check in with your network. That's proactive. That's exactly what we need to do. That's why this whole movement started, going on offense. How do we actually proactively reach out, connect with the people we know? I love what you said. I want to underline it many, many times. We all need to do that. We all need to be proactive, monitor those around us, check in with them, and address, because if you can address something before it becomes serious,
Yeah.
it never gets to the point of a mental health condition or a suicide or somebody reaching out for an addiction problem. It's so much easier to resolve the problem early, preventative, and just staying in touch with people. And I love what you said about, use the Google Hangouts or the Zoom or the FaceTime to create a whole group. I was watching a video this morning of like 30 people got on a Zoom meeting and literally just had a happy hour, like you said. It was just, let's just hang out. And after a while, you're like, I don't even remember that I'm not with you, because it's like I'm with you. I don't need to be personally, physically with you to create a great environment. I think the more we can promote that, push that, encourage that, the better, because we're not, this isn't going to go away tomorrow. And the more we can adopt practices and do things that actually proactively address the emotional well-being and just the, I love what one physician said a few weeks ago about the word social distancing is the wrong word. The right word is physical distancing.
Right.
We want to bring social togetherness. We're not trying to socially distance, we're trying to physically distance. Right. So we're getting close to the end, but I'd love to give you a few minutes to wrap up. Is there anything that you wanted to share about this partnershiping or creating a partnership with your physician to stay healthy that you didn't get a chance to share, or any last minute words of wisdom?
Yeah. So I want to emphasize again that fear is real, and to not address that, I think doesn't address the elephant in the room. And I think it's important that we recognize that as a society, and even individuals, that there's still a lot of fear that's out there. I would also say that delaying healthcare because of that fear is probably not a really good strategy, and that there are different mediums and venues by which you can interface healthcare in a safe way that continues you on your healthcare continuum. And that's really important. Everyone sort of sheltered in place and sort of shut down and sort of went into like hibernation mode. Mm-hmm. And I'm going to really challenge everyone on this call to say, okay, hibernation's over. I'm not sure if we ever should have hibernated, but hibernation's over. And now it's time to, I love that, Daryl, that it's physically distancing, it's not socially distancing, and that it's really time right now to take a personal inventory about what's going on with your physical and spiritual and mental health, and being very intentional, because you have control over that, as to what the next steps are in your healthcare. And we as the healthcare community will keep you safe. And I think there's a lot of questions still out there about testing that we didn't even talk about, just from a COVID standpoint, that I would encourage you that if you have questions, to also call your physician or healthcare provider, because we do have emerging serology testing that can answer some questions, not all questions, but I think that that's important. And I think that having that continued dialogue with your physician, I think, is really important. I would also say that, expanding what you think about for self-care. We didn't talk about service animals, but there's a lot of puppy adoptions happening right now, or animal adoptions that are there as sources of comfort and support. So doing maybe a little self-inventory as to what feeds your soul. And what brings you happiness, and then to really actively pursue them. Be intentional about pursuing those, because it is really important to do now, more than ever. And I would say to also reach out if you're concerned, and conversely, just reach out to others. I can't tell you how powerful the reaching out aspect is to others. that I've heard so many times across my career and more recently, that I'm so glad you reached out to me, because I felt really alone, and you helped me through that. So I think that it's important for us to continue to reach out, and that's part of our self-care, because I have to tell you, 9 times out of 10, we get more than we give when we reach out. So those would be my parting words for the group.
Thank you so much, Dr. Milavetz. This has been fantastic. In closing, I would like to just announce that our panelist for this this Friday will be Amy Javins. She's the founder of Script Fit. She's an endurance coach with QT2 Systems and a former professional triathlete. The topic will be promoting fitness for mental well-being. We'll be sending out a huddle or a survey after this huddle. We would encourage people to fill that out to give us feedback. If you've got any recommendations on future topics for these huddles, please share those. You can communicate with us through the Contact Us form on the goingonoffense.com website. Again, we want to thank Dr. Milavetz. Thank you so much. This has been fantastic.
My
We also
pleasure.
want to thank all of the organizations that have gotten behind this effort. If you'd like to check those out, many of them are offering free or discounted services. If you check out the help or the sponsors, supporters of this movement on our website, please do. And we are recording this. We'll be posting this on our website later today. To finish our Hub of the Day, I'd like to share with you a video I came across sharing some voices of children during this pandemic time. So I'll turn that on, but sign off. Thanks again. We do these every Monday, Wednesday, and Friday, and we hope you'll join us in the future. Take care.
Bye.